Hey, it's Carrie here from Wrap Your Head Around Silks. You're listening to the Expecting Aerialist podcast. Real quick, wanted to let you guys know in the show notes, there is a link to register for my free Aerial Silks mini course. For anyone, beginner to intermediate, it's 10 chapters of some cool little things and some pieces of advice for you. All you have to do is register to get into the student portal on my website. It is free for you as a gift from me. So just a trigger warning. Today is the third podcast in a row where we're really deep diving in a story about loss. So just to let you know before we get started, and today I'm so excited to have Dr. Rebecca Runge. She is a primary care physician based in Kalamazoo, Michigan. And I found her because she's a member of the Aero Mamas Facebook group. And I was just looking for some, new people that I'd love to talk to. And I wanted to see her perspective. She's an aerial teacher and, she is a DO, which means she is a doctor. And I got more than I was bargaining for because she has such a story for you guys. So without further ado, let's meet Rebecca. Let's talk about your profession and what you do for your job. I'd love to hear about that because that's going to inform the rest of our conversation.
I decided to be an osteopathic doctor when I was pursuing, applying to medical school. Started deep diving into the philosophy of osteopathic medicine and the differences between allopathic, which is MDs, and then osteopathic, which is a different philosophy of medical school. And when you graduate, you become a DO.
Okay. Yeah. Can you please break that down? Because I'm actually a daughter of an MD and I don't know a lot about the other.
Osteopathic medicine has been around a long time. At this point, medical schools in the United States are graduating about 25% of us are DOs.
Wow. Okay.
The main difference between an osteopath and allopath is the philosophy when we study medicine is a little more holistic in a whole person approach, not holistic necessarily in a, naturopathic, we're going to treat you all with herbal remedies sort of. We still practice Western evidence-based medicine.
Okay.
The big differentiating factor is that we learn musculoskeletal techniques that give us hands-on diagnosis and treatment tools.
Oh, that's interesting. I didn't know that. And how long have you been practicing?
About 7 years in full spectrum care, and then 10 years total if you count like residency when you're still technically practicing, but you're being overseen.
What was your experience there? And did it at all inform you on the motherhood side or the birth side? Of
course, all of my exposure in medicine helped me prepare for motherhood, even pediatric rotations and taking care of newborns at different points and that kind of thing. So you have some idea what to expect, but it's not your story until you're in it,
When I asked Rebecca to be on the podcast, I did not know a very crucial part of her story. And I'm somewhat glad that I didn't, because I love coming into these conversations from a point of view of curiosity.
I'll start with my first pregnancy. My first pregnancy, everything was going along pretty swimmingly through first trimester. We really didn't have any bumps in the road. I was one of the lucky ones without nausea and vomiting. And so I was able to keep teaching all the way through. But then we got to our 20-week ultrasound and had a surprise when they were looking through the anatomy scan, basically, that, they're trying to identify all the body parts and everything, do all the measurements. They did not find any kidneys. It's one of the ones you learn about that is just what we would call incompatible with life. So it's called bilateral renal agenesis.
Wow.
Basically, if the kidneys don't develop, then when you hit second trimester, the baby who is filtering the amniotic fluid. So they're actually like urinating inside of the amniotic sac, and they're like filtering the fluid. So they keep the fluid balance there. But if you have no kidneys, then you end up having no fluid. And if you have no fluid in your amniotic sac, then it's a very tight, constricted space that the baby's lungs can't develop. Not only do they not have kidneys, which, you can't live without kidneys unless you would get dialysis, but you also definitely can't live without lungs. So unfortunately, what happens with these babies is sometimes, well, in the past, before they used to do ultrasound screening all the time, these babies were delivered and then would immediately pass away because they couldn't breathe. I live in a state where you have to do something before, I think, 23 weeks.
Okay.
So I had the choice of having what's called a D&E procedure. So it's
D&E.
Yeah, like a D&C, but a little bit different because you're further along. So basically it's a dilation and evacuation.
Okay.
Sort of like how they help with birth, except helping to clear the products of conception of the fetus. Yeah.
Okay. Makes sense from a mechanical standpoint.
Yeah. So, or I could be induced and actually deliver during second trimester. Obviously, the baby can't live through that and would pass away immediately. Mm-hmm. Or they could let me go until full term and deliver and then have to immediately say goodbye. I don't know if it's my training in just trying to reduce human suffering, but I felt like the least suffering would be option one for both of us. And so that is what we chose to do. We found a doctor that could do an injection basically before the procedure so that it would stop the heart and it would be basically like, humane euthanasia. I had to go under surgery too. So like I had to be intubated and like full surgery.
Wow. Okay. Do you feel like your medical knowledge was beneficial or was it almost too much to know too much?
Ooh, I don't know, because I don't know what it's like to live on the other side.
I get that. I'm imagining like, I don't know, in some cases you'd like, okay, I'm just glad I don't know really, I
don't know. I always feel like more knowledge is power. But maybe that's also my training speaking. So sometimes, in my second part of my story, I would say it was hard to walk that line between being a doctor and being a mom. In this instance, I felt better kind of knowing what to expect. Yeah, I went under anesthesia and went through the surgery. And it was probably more traumatizing for my husband and my sister because how people say that sort of your true emotional self under anesthesia?
You mean like when you were like half in, half out and you were talking?
Yeah, like when they wake you up after surgery and you're totally out of it.
Yeah.
It's kind of like being really drunk, and
yeah, no, I remember the last time I was
just bawling, just emotional.
Of course. I think I was crying too, and I don't know why.
I think I must have been trying to stay strong right up until they put me under, and that didn't last.
Yeah.
So,
do you mind if I ask how old you were at that time?
No, not at all. Let me do reverse math. So I'm 36 now, and this was January 2019, 33, maybe not quite 34.
2019. That is a lot more recent than I had pictured for some reason.
Basically, both stories go like back to back. And unfortunately, what I sort of learned is I did not give myself time to grieve the first loss before moving right into the second one. Probably is very common. It was a very weird feeling because I went into surgery 20 weeks pregnant. And then I came out just like unpregnant. It was like shocking.
I cannot imagine, but yes, I can understand the
Right. And so I don't, obviously I knew that my body had changed and that it was going to take a little bit of time. But I didn't really like treat it like a postpartum period, like you should, when when getting back to life. And I didn't really allow myself that much grieving either. I barely took time off work. I had the surgery on a Friday and I came back on a Tuesday. Like it was sort of nutty. I was teaching aerial through all of that. I ended up going to NECA actually for a Nimble Arts teacher training in February, and this happened in January.
Oh, wow.
That was my original plan, was to go while I was pregnant. I asked ahead of time and I said, hey, I realize I won't be able to do everything, but I want to be there and learn. And then when I showed up, I was not pregnant. And I was like, how do I tell them? I wonder if they even remember that they told me, that I was going to be pregnant. I had to have that awkward moment of vulnerability halfway through the training. This is why I'm struggling a little bit, because my core is just disconnected at this point. I'm postpartum doing some of the conditioning stuff. It was just harder than I was anticipating.
So 6 months later, you guys decided to give it another try. Yeah.
Oh, and I did pelvic floor physical therapy in there too. Because I actually had more problems rehabbing and going back to aerial after the first one than I did after full giving birth. Or just
that's interesting.
Kind of weird. Maybe it's what they say, people hold a lot of emotion in their pelvic floor. I had to go through a fair amount of uncomfortable procedures too. Because even just for the D&E, they actually have to dilate you. That sucks.
Does that just mean that they're opening up your vaginal canal way bigger than it wants to go?
Your cervix. So they're
cervix.
They're forcing your cervix to dilate so that you can be wide enough to deliver.
And so do they give you the drugs that help soften it and then stretch it manually?
Right. Yeah, pretty much.
Oh God, this sounds terrible.
Yeah, that wasn't very fun. And they don't put you out for that. So they gave you Cytotec, the normal stuff to soften it up. But then they used these little thing called laminaria, wooden plugs sort of, or reeds. And it's really weird that they're made out of a plant, an actual plant material. But the point of it is that they expand when they get saturated. It's like a seaweed reed that expands and it manually dilates your cervix.
And so it becomes like a tube.
Yeah, and they were placing a bunch of them next to each other. They made me come back twice because they were trying to get it large enough to get, 10 in there or something.
Wait, they leave the reeds in there?
Yes.
Oh my God, how I literally learn something new every day. I have no idea.
They place them and then they're like, okay, see you later. And then you go home and you're basically in you're in early labor sort of, because you're dilating.
So it's not like a tampon. It's
no.
It's short and then they stick it up there so then it opens up kind of
right.
It's crude to say this, but those ear hole stretchers.
Yeah.
I even lost what we were talking about in the first place because my mind was so blown about this reed situation. So please remind me what they're doing with this procedure.
They needed it to be dilated enough for them to do the surgery. This was while I was awake, the day before.
Oh, God.
That was the worst part of the procedure.
DNE, not DNC. And they don't do this dilation for a DNC.
Not that I've ever heard of.
Rebecca, okay, so let's go into the next chapter of this story. And I, again, want to thank you for being so vulnerable and open because this cannot be easy to talk about. I know it's on your Instagram page and you really let the world in, but I think that you're definitely not alone out there. It's just that it's not a very common, I'd never heard of what happened. So
we waited about 6 months and then started trying again. And then I think by about 9 months, I was pregnant. Obviously, because of the first one, I was super nervous. I basically held my breath the entire pregnancy.
The anxiety must have been
Yeah.
Off the charts.
We had early testing, like extra ultrasounds and genetic screening. We had genetic testing after the first baby, and they told us, it's probably just sporadic. This type of formation just happens, and there's no reason to believe that it'll happen again. So we had some ups and downs. I would say like it was a roller coaster really from the beginning. Some of the ultrasounds looked a little like there might be something. They weren't sure. One of my genetic tests came back positive, but then another one came back normal. And then, we had multiple ultrasounds before we got to the 20-week scan, which was the big anatomy ultrasound, And when we got to that one, they were like, okay, so we see enough things on here that we're concerned. And we need to do an amniocentesis. So I did actually have that done too.
Okay.
Which is basically a procedure where they insert a large needle into the amniotic fluid and take a sample so that they can look at DNA to try to determine if there's something chromosomal going on. And then that came back normal because they were really just looking for major chromosomal abnormalities, and she didn't have any of those.
Okay.
Then, we progressed. They did know from the ultrasounds that that she had a heart defect. So we had been referred to get fetal echo where they look closer with an ultrasound at her heart while she's in utero.
Okay.
We knew that she had what's called a complete AV canal defect, which is a pretty major heart defect, and it does need to be repaired with surgery, 6 to 12 months of life around that time.
Wow.
Yeah, so we knew that was coming, but at this point, that was all we knew for sure. And so we were like, oh, it's okay. We can deal with this. It's just baby heart surgery. Lots of people have to go through that. Everything's fine. And then during these consults with U of M, we had, another ultrasound and another fetal echo with them when we were meeting the pediatric heart surgeon. And then with further workup at U of M, we had an ultrasound that showed I had almost no amniotic fluid.
Huh.
Yeah. So all through second trimester, baby was fine. So we had been reassured about her kidneys. We were worried about her kidneys the whole time.
Right.
And then all of a sudden, no fluid. And so we're like, oh no, this has to be another kidney problem then. They thought that maybe she had a horseshoe kidney, which it turned out she did, which is when just one kidney forms and both kidneys are connected and it creates kind of a horseshoe shape.
Okay.
Apparently was not functioning well because I didn't have hardly any fluid. At this point, we have a sit down with the OB or maternal fetal medicine, which is kind of the high risk OB. And they're like, okay, this is bad news. We're delivering you bad news. Chances that this baby will live maybe even to the end of this pregnancy, maybe through delivery, maybe only a couple weeks after delivery. So that was a big shock, obviously. Yeah. So at that point, you're just along for the ride. There's not a lot you can do at that point. So we had a few consults and they sort of gave us options as to how we wanted to proceed with the delivery.
Yeah.
I wanted to make sure that she had the best chance she was going to get. So I wanted to wait until I was full term, for sure. We did end up deciding to be induced. On top of all of this, she was breech.
Oh my God.
Yeah. And with no fluid, there's no chance she's going to flip. I tried the whole spinning babies thing.
Okay.
At home. Basically it's a bunch of inversion exercises. I was like, oh, I got this.
Yeah, sure. Yeah.
I know how to be upside
down.
That didn't work. So she remained upside down. What did they call it? Complete breech, I think, where she was butt first with her legs folded up.
Oh, wow.
So she was folded in half.
it was just so tight in there. Is that?
Yeah. Because basically she didn't have fluid to like move around in.
And so when you don't have fluid, obviously that's not a good thing, but it's not detrimental, is it?
No, I mean, it can be. Like, it can give them musculoskeletal problems, just from like being cramped and not being able to like fully form the last bits, But luckily, like at that point in third trimester, like all the important bits are pretty much formed. It's just growing bigger. Her lungs had already formed because that part was earlier in second trimester.
Because I know nothing about this. So it doesn't matter how hydrated you are. It doesn't matter how much water you're drinking. You're just peeing it out. It's not ending up in the amniotic sac.
Mm-mm. No,
okay.
There's nothing I could do. At that point, that amniotic fluid was up to her.
Wow.
She had to pee it out.
Okay.
Yeah. All of this bad news was coming right like March 2020.
Oh my God, this is terrible. And you don't know where the world is going because we've just shut down at that point.
Yeah, it was nutty, So like my studio shut down, which was probably a blessing for me. Everything stopped, It was like a weird blessing in disguise that we could be home and like processing this information and not have to see people.
Yeah. And not have to explain it to everybody. And
yeah. But even my job, we tried to convert a lot to virtual. So, and plus I was pregnant, so I was high risk, and they were like, okay, you can be exclusively at home. So that was really weird. I've never tried to practice medicine at home. Mm-hmm. But I was doing all telephone and like video calls with my patients and trying to figure that out at home. So I don't know, good and bad there, but things slowed down. Even work slowed down. I wanted to be able to, like I said, give her the best chance I could. And part of that was I wanted to deliver her, I don't want to say naturally because all childbirth is natural, but without medicating much, because I didn't want it to disrupt like her, breathing or being like more sedated than normal or anything like that.
She wasn't facing the right way. So how did you avoid having a C-section?
Because I was kind of rotating with midwives previously before I was like a high risk pregnancy. And then I was seeing the OBs that were in the same practice and just seeing docs. And I kind of like pinpointed an OB that had more experience delivering breech vaginally. And she was very small too. So that was to my advantage. Part of what we would later find out with her genetic syndrome is that she had growth restrictions. That made it a little bit easier to deliver her breech folded over like that. So I told them, I would like to do it vaginally instead of a C-section, especially if this is going to be like a palliative care sort of situation, because I want to return to aerial. I think it'll be easier, if I don't have a C-section. And they were like, okay, this is your birth plan. This is what we're going to try to do. All of that went well.
Really? Okay.
In terms of my delivery, it was super smooth. It was weirdly fast for a new time. Like, usually first moms, especially being induced, mm-hmm. I was expecting, I'm going to be in the hospital for like 3 days, like trying to push this baby out. But no, I was admitted at like 7 a.m. and then they started meds. They only did like vaginal Cytotec, 4 doses, maybe 3 or 4 doses, and like 3 or 4 hours apart. I had a doula, and I was lucky enough that she was going to be allowed to come. Things went so fast that like my husband was not able to text her really in time, and she arrived when I was getting ready to push. She felt really bad about that, but it was not her fault.
So how long between them giving you some of those meds and then?
That evening, probably I started being medicated at like 8 a.m.
Okay.
And then started really moving by 8 p.m.
Okay.
Like I would say I was like active labor, like probably if I had to guess like 6 centimeters or so dilated. Because it was like a palliative care sort of situation, they let me not wear all the monitors all the time.
Okay.
And they didn't do as many cervical checks. I didn't have any cervical checks. And I think I was afraid to ask for one because I was going to be mad if I was only at 3 or 4. Because things were progressing pretty quick and I wanted to be in the bathtub, the more painful parts. So that is what we did right around the time that I think I went into active labor and was probably 6 centimeters. Instead of doing a cervical check, I went in the bathtub. I had a lot of hip pain. I don't know if that's normal. It wasn't back labor. It was like deep in my hips. Like if it was like drilled into my like psoas muscles. So my husband, we had done a lot of reading on like breathing techniques and like things he could do to help me. And so he was like squeezing or pushing on my hips to help relieve the pain and like counting my contractions and everything between contractions. And he was so busy doing that like we didn't like reach out to the nurse or the doula or whoever else. We progressed myself all the way into like transitional or like fully dilated in the bathtub.
Wow.
Like in less than 90 minutes.
Wow. Okay.
Because they said you can only be in the bathtub for 90 minutes. And I said, okay, I'm going to stay in here my whole 90 minutes. I didn't even make it 90 minutes. I basically like stood up and was like, whoa, I feel a lot of pressure. Then we ended up pushing and not very long either. Because when they're breached like that, you don't want to spend a lot of time pushing
So the baby came out butt first.
Yeah.
Wow. Mm-hmm. I don't even think I've ever heard of that. Although apparently my sister came out both feet. And then my mom was like, yeah, I just saw both feet come out and the doctor's just yanking. I'm like, oh my God, what was it? 1976. I'm like, oh my God, please don't tell me the story.
I know. Well, I mean, they used to deliver all sorts of breech.
Yeah.
I mean, that was normal then. And my doc was awesome. We didn't end up with the same doc I had planned, but she did great. The one who was there overnight, because I didn't make it as long as we thought we would. So the doc that was supposed to deliver me showed up in the morning and was like, what happened? And I was like, sorry. She said it was like 30 seconds from butt to head. Like basically like the butt came out and then she like swept out like 1 foot at a time and then turned the baby a little bit. And then I pushed out the head.
Okay.
Well, arms were in there.
Yeah.
Too.
Yeah.
Legs, arms, then head. But yeah.
Okay. But this is not a normal pregnancy. So
right.
What happened then?
Yeah. In the moment, you're just so focused on labor.
Yeah.
When she came out and all was said and done, then we kind of like reassessed the situation and, she looked good. She had good APGAR scores and, they did some suctioning and that kind of thing, but she had a strong cry and she did, sort of first latch. She never was able to fully latch because she ended up having some like mouth facial issues that got in the way and a tongue tie and that kind of thing.
Okay.
But she did the whole chest to chest thing with me and I had pumped before she was born. And so I had a little colostrum. So we like fed her with Q-tips and syringes and and basically we had hospice on board already. And we were expecting that basically she would probably live like a couple weeks. So that's about how long it takes when you don't have basically when you're in kidney failure. Luckily, it's like a peaceful death. In terms of how, I guess, choices to go, you just kind of peacefully, you're kind of sedated at the end. Even, adults, I've seen adults in renal failure.
Can you tell me, I read about it. This is called, can you please pronounce it? I'm going to butcher.
Cornelia de Lange
Yes. Syndrome? So I had never read about anything until yesterday.
She was not diagnosed until we actually sent out her genomic like sequencing testing.
Which is after she was born.
After she was born. Mm-hmm. Yep. So they sent out some of her blood. They sent out our blood so they could compare. And they sent it to like a children's hospital in California who was doing basically a genetic testing program.
Okay.
I think we got the diagnosis like a week or 2 into life. Yeah, and so then we just started learning as much as we could about that.
Of course, the questions that I had when I was sitting down to read this and the questions that the podcast listeners will probably have, is there any way to know that the baby has this before giving birth to the baby?
No, not really. There's certain features. So they have like what's called a phenotype that really a lot of those things are not apparent until they're born, because it's a lot of like facial things. So like she had, a small chin and thinner, flatter mouth. They tend to have a little bit more hair. So like she was born with a full head of hair, a little bit of a unibrow, just small ears, small nose, button nose. That genetic syndrome, it's a syndrome, so it's pretty wide in terms of like development and how severe it can be. So there's like really mild cases to really severe cases, like even not having fully formed limbs or missing limbs. And there's different genes that are affected. We had the most common version, which is the NIPBL gene. After later testing, we found out it was what's called de novo, which means just she had it. Neither of us were carrying a gene.
Really?
So just another round of bad luck.
They knew something was going on. They knew it wasn't normal, but the kidney was probably the biggest indicator that it wasn't. You knew what you were in for.
Funny enough, the kidney problem actually ended up being outside of the scope of Cornelia de Lange.
Interesting.
They can have genitourinary problems, but not usually to that severity, not like born with kidney failure or a dysplastic kidney, which is what she had. They couldn't really explain that. It wasn't until later in my story that we got more information about that piece of the puzzle. Yeah, so she went home with us on hospice, immediately started peeing diapers like a totally normal newborn. Yep.
So you're like starting to become hopeful.
Yeah.
Oh, okay.
We had hospice support, which meant like a nurse came out and we had a doctor assigned and they made sure we had meds in case we needed to help her out if she was in pain or anything. But we ended up not really like using many of those services other than to help us with like normal newborn care. She was born 3 pounds, 8 ounces.
Wow.
Yeah. So, and because we were, palliative care with like a poor prognosis, we just totally bypassed the NICU,
Yeah,
like
that's what I was going to say. Like,
definitely have been a NICU baby.
Oh, yeah. Oh, my God.
Yeah. Yeah, no. So instead we just ran a home NICU. Like it was like kind of ridiculous, but it was great. And honestly, I think she did a lot better because of that, because she spent just time with us. We were her incubator. She 100% spent time on my chest or my husband's chest the first like week. We syringe fed her and, she was on a tight schedule every 3 hours, eating at least. And I had to exclusively breast pump because of her feeding issues that I mentioned earlier. And so that was a lot of work. I mean, we were deep in sleep deprivation with like a medically complex child but she was doing great. I mean, she was hitting all the normal like newborn marks. We had to like scramble to get enough like preemie clothes. I mean, she was swimming in preemie clothes. And so people came out of the woodwork though. It was wonderful. The amount of support that we had, and my family lives close and his family was only an hour away, and people stayed the night, to let us get sleep. And,
my friend's baby was 5.5 pounds. And I remember seeing this baby and I was like, wow, that is a tiny ass baby. Now I'm thinking half that. That's basically half.
Yeah.
I don't even I know. So delicate. I can't even imagine.
You saw some of her pictures.
Yeah, but it's hard to get the scope of it. You know what I'm saying?
Yeah, I have this one picture of her like laying by herself in her crib. And it's really funny because she's so small, like compared to the rest of the crib, just a blank, mattress. And yeah, it's funny because you get used to it. Like at first, for any parent, they're like, oh my God, a tiny thing, like I'm going to break it. And then you just get used to it. And then she was like a normal size, like to the point where, she met a couple of my other friends' babies. and they looked like ginormous. Like, I didn't understand. I was like, why is your baby so large?
Yeah.
Yeah. So you just get used to it. I don't know. Like I said, I held my breath the entire pregnancy, and I was just tired of holding my breath. And as soon as she was there, I just abandoned all, I don't know. I just poured myself into it. I was like, whatever happens.
Yeah.
She did really good. Our goal was to get her to 4 weeks or 1 month of life. And then we would feel kind of like more confident that she was going to exceed expectations. Because really, if, she was in kidney failure, it should have happened faster. We made it to that landmark. She was still technically too small to put in our car seat because part of Cornelia de Lange is a slow growth curve. So they have like their own growth chart, and it's incredibly slow.
Okay.
We fed her as much as we could feed her, and she wasn't growing very quickly. Slowly, but not very quickly. And our car seat went down to 4 pounds, and she was like still not quite 4 pounds. We got her into a pediatrician, and we actually walked there. We walked like 4 miles to go to the pediatrician. Yeah, so we got in with the pediatrician, started seeing the specialist. We figured we need to find out what her prognosis is for real, because she was not really doing what was expected for her disease process. And I think I would have beat myself up later if I didn't find out like the true state of her kidney function. So we got her in with a GI specialist because she had really bad reflux and feeding issues. And then we were just getting in to see the kidney specialist when she really started like turning a corner and kind of going downhill, because she had that heart defect, which honestly, she never really showed any signs of having any problem with her heart, but she also had intestinal malrotation, and her feeding issues made her more sick. And we ended up having to put in an NG tube, which goes down her nose and into her stomach so that we could feed her. She got hospitalized for a whole week because of her. Once we found out her kidney function, it was pretty bad, and her electrolytes were sort of in dangerous levels. So they made us go in and start doing like IV meds and all that, and change her nutrition plan. She was breast milk, but supplementing as well. She got sicker and sicker. Like basically, as soon as we started trying to intervene, she kind of went downhill. It happened pretty quickly. The second hospitalization, I think she aspirated, and she couldn't breathe very well, and she had fluid in her lungs. And so we had to rush her to the hospital at 4 a.m. And we didn't want to go down the route of being on a ventilator and all that jazz for her, because we'd always wanted her to be comfortable. That, was the plan from the beginning. So yeah, basically we got the kidney doctors, the nephrologist, to finally like sort of own up to the fact that there was nothing they could do except for like heroic measures that had 1% chance. Basically involve like her being hospitalized for a whole year with like breathing and dialysis support.
Wow.
Because she was on a slow growth curve. Like her only chance of survival would have been a kidney transplant, and she wasn't going to grow to the like fast enough for them to put a adult-sized kidney in her for like years, and things couldn't come together. So yeah, we started feeling hopeful, and then sort of started getting more and more information, and having to accept kind of back where we started.
And this was a couple weeks, 2-3 weeks, 3-4 weeks?
She lived for 9 weeks. Yeah.
Oh, okay.
Yeah, so longer than anyone expected. Mm-hmm. And then we brought her home with hospice, and she passed away at home, which is how we wanted, her to feel comfortable. So
I'm so sorry.
Thank you.
And you had just told me at the beginning of the story that that moment when she passed away was almost a year ago.
Yep, she was born in May 2020 and she passed away at the end of July. So
wow.
So it's been a year.
Yeah. I didn't know about the first pregnancy, and I knew yesterday about the second.
Yeah, I know. I had lots of surprises in store for you, didn't I?
I actually prefer it this way because, I'm hearing it for the first time, and it's just gut-wrenching. It's gut-wrenching. And
yeah, it's become a lot easier to talk about, basically, with therapy. At first, it felt like a black hole, that I was like afraid to even take the first step into, to grieve. You know how when you're a teenager and you have a breakup and you have that like just guttural crying episode where you're just like, let it all go, real heart-wrenching crying. I was like too afraid to do that because I thought I would never come up for air again.
Oh my goodness. I mean, I can't imagine a lot of the things that happened. I have pretty consistent anxiety, even with medication. Like I try to think of what it would have been like for me to be you in that second pregnancy. And then, lack of better words, for your worst nightmare to come true in a way, even though it was slightly different than the first time around. And what did end up happening, it's beautiful. The story is heart-wrenchingly beautiful. Like that you got to meet her, that you got to spend time, but then, the whole is bigger when she's gone. I can only imagine.
Exactly. Yeah, exactly. Like I wouldn't give that time back. Definitely not.
Yeah.
It was totally worth getting to know her. With my first pregnancy, I grieved the idea, he was a part of me. We did name him too, by the way. My daughter was Adrian and my first pregnancy was Ethan.
Beautiful names.
Thank you. But it was different with him. I never got to meet him, so I didn't get to know his sort of soul before losing him. Mm-hmm. So it was different with Adrian because I got to know her, and a lot of people did because I did choose to share my journey on social media, and I'm kind of surprised that I did, but I'm glad in retrospect because she really touched a lot of people. Just reading about her week to week, because I would pretty much post like a weekly update and a picture and that kind of thing, and it was pretty amazing how many people reached out or could identify in some way or be supportive. People were praying for her in Ireland. Like it was crazy. Grief is like a whole topic on its own, but therapy was very helpful. I did weekly for a long time. I went back to work too soon, although I don't really know when's a appropriate time to go back to work after that. I sort of had to at some point. No one really tells you how much grief can cognitively affect you. You sort of feel like you're operating in this cloud. Yeah. I didn't feel great about performance. I was, getting by. I was doing a good enough job, but I was not being the doctor I wanted to be. So I did end up going on some antidepressants, and that helped a lot. Just kept doing therapy, and honestly, it was just work and time and talking about it. So.
I cannot imagine now that I am a mom. I think about people who lose their children at any stage of life, whether it's when they're really young, like yours, or My friend, she lost her boyfriend at the age of 25 and his parents, type of thing. Or just any parent that loses a child who buries a child.
Yeah.
Now that I'm a mom, the idea of that, it makes me feel like I wouldn't survive. I say to myself, I wouldn't survive. I wouldn't. I'm sure I would change in the process, but the thought of that makes me think that there's,
Yeah.
I don't know how people do it.
I know. It's funny because everyone says, I can't imagine, but the truth is that they can if they've gotten to a place they can say that because, you're an empathetic human being. So you can place yourself in my shoes and think.
Well, it's both because, it's so hard to understand how a human would be able to go through that unless you're in that position. But then also I have a daughter, and if for some reason, she's here and then she's not,
right.
I don't know how I would survive that, to be honest. So I listened to your story. You said the whole topic of grief, it should be a whole mini series, which, by the way, I think that's what's happening on this podcast. Maybe we'll come up for air in a couple weeks and we'll go back to more normal, baby raising topics. But
I don't know. I think it's important to talk about. I think it's totally normal what you said, to not know how you would survive. It's very normal to go to a dark place where you're like, why bother? That's part of the grief stages. And you just, I've read a fair amount, trying to sort of wrap my head around certain things. And you learn that grief is not really something that you complete, that you just sort of endure. And it really changes who you are because you have to learn how to live your life after the loss. Mm-hmm. You find new meaning in not why there was a loss, but what you want to do. What do you want the rest of your life to look like? And you have to think about all those things. I mean, there's not a lot of times where you stop like that and you say, what am I doing? How do I want to proceed from here?
Yeah, because it's a life altering. It's a life altering event. There's not a lot of things that are that life altering.
Right. Recommend a couple good books.
Oh, please.
If that might help somebody else. There's a book called It's Okay That You're Not Okay, and that's by Megan Devine. And there's a book that I haven't finished reading, but it's called Finding Meaning, the Sixth Stage of Grief by David Kessler. And he's one of the people who invented that whole 5 stages of grief thing. Everybody misused it. So he felt like he needed to go back and talk about the 6th stage, which is finding meaning in the rest of your life, finding meaning after the loss. Yeah, we've done a lot of nice memorial things and donations, and I donated my breast milk, little things that help make it feel like her presence is living on. And so that's important to me. Yeah, I'll take her with me wherever I go.
I'm sure you've heard this a million times, but I'm going to say it again because it's new to me. You're incredibly brave to want to even share your story and do it in a public way. It leaves you vulnerable in a way, but you seem to be such a strong individual, as is my friend Helen and Erica, who have also done the same with their stories of loss.
Yeah, there's a lot of strong people out there. You don't really notice until you go through something, but then you start picking them out. Even in my patients, there's so many different forms of trauma or loss or grief that people go through, just horrific things that people endure. And it's kind of amazing.
It's really amazing. It's really amazing. So now you're a year outside of her passing.
Yeah.
You're practicing medicine. You are doing aerial?
I am, yeah. I was nicer to my body the second time around, partially because I was grieving. I was exercising, but not doing aerial until 6 months postpartum. And then I went back to teaching at 9 months. I'm the aerial program director at FlyFit here in small town Kalamazoo, Michigan.
I love it.
Yeah. And I mean, luckily I had trained, instructors to be teaching. And so they kind of held things together while I wasn't there, and they were amazing. And I'm lucky to have a very supportive studio owner who has also been through things in different ways. And she gave me all the time I needed. And I was glad. I came back and found my passion again, because I was honestly a little afraid that I just would not feel as much joy in things anymore. But I did. I'm back, and I'm really enjoying what I'm doing. So I alluded to it, but what we found out after further genetic testing was that Adrian's kidney problems was actually probably due to these variants of unknown significance that were inherited by my husband and I. We each have one. And this was something that we got tested for this renal panel sort of along the way. We each have a mutation. One copy of our gene has a mutation of this on the same gene. And both of our kids got both of ours. Don't ask me what the statistics are for that, because
well, I can't imagine it's very common that a couple gets together and they both have this gene.
Right. Well, and they're different variants. They're just on the same gene.
Okay.
Technically, it should be 25% or less. You would get one of each from the parent if it's autosomal recessive. But that happened twice in a row. So the first baby, they think that's why he had renal agenesis. And then the second with Adrian, they think that's why she had the kidney failure, which was totally separate from the CdLS. Yeah, we are just a bag of genetic problems.
Yeah. Okay. Wow.
But the silver lining to all of this, yay science, is that we are embarking on an IVF journey. So there's light at the end of the tunnel.
Okay.
Yes. We had the geneticist was working with the research lab at MSU. They've decided they think these variants are promising enough that testing lab is willing to do pre-implantation genetic testing for these variants.
Oh my God.
Yep.
This is amazing.
Probably going through the process at the end of the year, egg retrieval and embryo making, and then checking those embryos to make sure that there's no variants and there's no CdLS and hopefully no other major.
And then you can have quadruplets and be done.
No, they actually only put in one.
Oh, okay.
I was no, I am not signing up for twins. I do, I do want this family planning thing to end with hopefully 2 kids, but I don't think I want them both at the same time. So,
back in the day with the Octomom, I think back to that. I was not a mom back then. I was oh, this is a hilarious story. And I'm that is
not even possible. I don't understand.
My bean did not sleep the first year of her life. I would have.
Oh my God.
I would have just cracked as a person. If it was 2 of those, because you would never sleep and then you would go crazy, literally. Anyways, I'm glad there's a light at the end of the tunnel. We're going to give you good juju, the worldwide aerial community is going to give you good juju for your IVF journey. Helen, actually, you'll hear it, even though it's not out right now. It'll come out right before yours, that she went on an IVF journey successfully as well. And then had a baby naturally after that, after all the stress. Then they had a baby naturally after that. So you have 2. Rebecca, I thank you with all of my heart. And I always say, man, I'm going to have a lot of friends after I'm done producing this podcast, because I'm not really one to go out, meet new people,
It's lovely. It's funny how small of a place the aerial community is. And
yeah.
I got to know April because of that Aerial Mamas group. And she actually followed all during Adrian's life and was private messaging me. And
April's the sweetest. She's so sweet.
I know. She's so sweet. I've met so many people just sharing my story. It's awesome. I had a little bit of imposter syndrome, actually, when you asked me to do this podcast. I was what? I'm not famous in the aerial community. I don't I'm not a professional.
Well, the thing is that is not really the requirement. Although there's going to be a mix, not to sensationalize your story, but if I were like a reporter, I look back at like me just, reaching out to you because you do aerial and you're a doctor, and I've never had a doctor. Just a, primary care doctor. I'm like, oh, that's a good, like, diversity. I got a lot more than I bargained for.
Yeah, you did. It was a lengthy story. I made notes because I was like, how am I gonna like get this down to podcast time? Like, this is a long story.
You don't have to, because editing is magical.
Fancy.
Yeah. No, I totally got more than I bargained for from an editorial standpoint. And and the world got the benefit of hearing your completely brave and wrenching and beautiful story.
Oh, thank you.
Thank you so much to Dr. Rebecca for being here, being vulnerable, and sharing with us her incredible story. Just a reminder, in the show notes, there's a link for registration for my free mini course, 10 chapters of really great information, free for you guys. All you have to do is sign up for the student portal and you can access it. Thanks so much to Asa Watkins for post-production. And if you will honor me with the 5-star rating and review anywhere you get your podcasts, it really helps others find me more easily. And thanks for listening. You've been listening to the Expecting Aerialist podcast.
Is that your bean?
The bean has woken up and she gives me this why, like, dare leave me in there. What are you thinking? Like astonished that I would go in the other room.
Actual name, I just know her as Bean from all your posts.
I know. Her full name is Willa Mae Watkins.
Ah, Willa. That's pretty.
Willa Mae, or as my parents like to say, May May.